So, welcome everyone. For those of you who are here, thank you so much for joining. And those of you who are watching this on the replay, thank you for taking some time out of your day to listen in. So, clearly, if you have signed up and you are here, it's because something about you on this journey, period to postmenopause, or either a weight loss journey, is on your mind, or you may feel stuck, or you have questions about, right, the ever trendy or the ever mysterious, any type of GLP. So, again, those of you who are live, please go ahead and you can drop any questions in the chat at the same time, or if there's anything specific that you want me to go over. Let's make sure that you drop your questions in and I will catch it in the chat. So we're going to go ahead and get started. All right. So first things first, before we leave, I want to make sure that number one, everybody feels like um, nothing is off limits. You do not have to feel nervous or embarrassed about any question that you have. And I want to make sure that you understand why we're here. We're having this conversation because these are the things that happen in, I want to call it the whispers of the world. They're happening in while you're at work. They're happening when you are talking to your friends. They're happening at the gym. They're happening at your doctor's office. But I think so many of us are hearing things that may not necessarily be truthful or honest about either weight loss medications or weight loss in general. So today I really want to go over what these really mean. And some people just call them the shots. So I want to make sure I'm clear about if it's Ozempic, Wegovy, Manjaro, all of it. And my promise to you tonight is that you're going to get no hype, no shame in either direction. I like for everybody to always understand pros and cons of any type of weight loss medication or tool, because that's what they are, any type of tool, but also things that you may be struggling with around weight loss that you have felt like, I'm not sure why I'm not able to, but let me hear the real on what's going on. All right. Okay. So again, most of you, half of you who are watching this have probably tried it, or you're on one, or you are quietly trying to figure out, or you're quietly trying to figure out if you want to do it. And don't worry, I'm not going to ask you to a show of hands tonight, but just know that I understand that that may be what's going on. And then some of you may say, nope, I never want to do that because I just want to lose weight naturally, or God, I've been so nervous because of all the things I hear. So understand this, that these are tools. And for anybody, I like for clients to know, or individuals who are potentially thinking about it, if you ever choose any type of weight loss support, there's no moral compass there. There's no issue where you say, hey, I'm failing. But those of you who choose not to, who say, nope, nope, I want to do it the classic way, which is diet, exercise, and just building habits alone with no assistance, it doesn't mean we're superior. It just means that we've chosen a different route. And then those of you who aren't sure, just know there's no judgment. Okay. And I get a chance every day to work with women who are using all of the tools, those who only want diet, exercise, habits alone that are the tool, and those who actually want other tools, i.e., medications to help along with the habits that we're building. Okay. So just know no judgment in any way. And neither of these routes is better than the other. They're just different choices. But no matter what, the strategy is still the same around. You must create new habits, new skills around how to eat differently, how to exercise in the way that works for you. We must manage sleep and stress management. All of those things, and we must lift weights, right? We must exercise, we must lift weights. All of those things remain the same no matter the choice you make or no matter the tools that you decide to use. And remember, anybody who is live, go ahead and drop your questions in the chat. And then those of you who are watching this later, of course, you'll have the opportunity to reach out to me and you can ask me those questions later. Okay. So, number one, what exactly are GLP-1s? Because there is a lot of confusion and a lot of things going on that make you feel like, whoa, this is crazy. Okay, we've got a couple different things. So, number one, the names of them, because you hear a lot of names. Semaglutide is the main name, but they go under two generic names, which is Ozempic and Wegovy. Then there is tirzepatide. That goes under Manjaro and Zepbound. Okay. Same family, but the medications function slightly different. The Ozempic or semaglutide and Wegovy of the world are really what we call a single agonist. It targets one receptor, and it is the receptor that is in your brain and then through your gut. The terzepatides, which is the Manjaro and the Zepbound, are going to be targeting two different receptors. So that is why people have different outcomes with both of these different types of medications. So the way they work, these all mimic gut hormones that you guys already have, and they help to control appetite, fullness, and some people will say it slows digestion or it slows gastric emptying. It's not necessarily that that's what it's doing, but it does allow food to stay just a little bit longer, or it allows you to acknowledge fullness longer. It also will steady anybody's blood sugar. All right. And so also it helps people with the food noise that might be going on in their head. That's really important. But why is this something that a lot of people may be turning to? And it's a real medical question. It's not a vanity question because there's so much ladies be happening beyond just weight loss with these particular medications. They improve blood sugar control. So someone whose A1C or glucose levels have been rising, it helps lower it. It also helps support people who have what we call real metabolic concerns. That's the start of cardiovascular disease, high blood pressure, or if they have high cholesterol. So these are not just beauty products because that's what a lot of people think. They're just weight loss drugs to help people lose weight so they can look better. No, there are real concerns going on. And some people feel like, whoa, the side effects are so significant that I really don't want to do it. So I want to dispel some of that. Are there side effects? Yes. And some of those side effects can look like nausea, constipation, maybe some stomach upset, but it's really early on if someone is using it. But understand this, none of these work like magic. None of these are evil either. They are just a medical tool that helps control some of the food noise, and it also helps with some metabolic concerns that men individuals may have. But what is noted is we always want to start very low and build up. That is how people minimize the symptoms that you guys may be hearing out on the street when people say, oh my God, you may be hearing people say they had diarrhea, or you may be hearing it as a hearsay. Or you're hearing that people have been constipated completely, their stomach is upset, they're vomiting, they have nausea every single day. That's not really true at all. Those things are really heightened when people have dosing that is too high. Okay, understand when they have dosing that may be too high, or they started at a dose that was too high initially. That's why you always want to have the lowest, most effective dose. And when you follow those protocols and someone is monitored using it from reputable pharmacies, you actually have a prescription, you do not get many of these side effects, or they're very mild. Okay, again, very, very mild. Let me make sure if I'm not missing anything in the chat. And again, drop your questions in the chat if you have any. Okay. All right. Now, what are these drugs approved for? Because as I said, these go for a lot more than just weight loss and way more than vanity. These drugs are approved for blood sugar, meaning people who have type 2 diabetes, or for many people in this age range who are starting to see blood sugar rise or pre-diabetic. All right. It will help you manage blood sugar, and that's specifically the Ozempic Manjaro. Heart health. This is very important because a lot of people don't understand that that's why they may be prescribed it, or a doctor may be speaking to someone about it. And it's individuals who either have increased risk of heart attack or stroke, someone who already may be showing signs of cardiovascular disease, or someone who we're seeing that they do not manage blood pressure well, and it's been a very long time, also to coincide with weight loss that they need. So Wegovy is 100% approved to reduce the risk of heart attack and stroke in adults. all right, with heart disease or excess weight. So that's really creating protection. So in the long run, some of these things basically get people to a place where they're no longer on any type of blood pressure meds or water pills. So remember, some people can be on 3 and 4 different meds for pressure. And these particular drugs in the GLPs can help people get off it. New this year, Zepbound is a part of sleep apnea medication. People can get approved now for sleep apnea. So anybody who has obstructive sleep disorders, they can also get on it too. So there's dramatic results. I actually have a client now who is short. She's on the petite side for height, but she has been floating around 300 pounds. I've known her for a while, and she is a client of mine now. But she also was approved based on her sleep apnea. She has a CPAP machine. She's already lost 20 pounds, but we're doing it in a way that's very slow. She needed to be able to focus on using the medication to handle her sleep issue because of how her current weight, but also she had a knee problem. Okay. The next thing is kidney support. Ozempic is actually used to help slow down chronic kidney disease. So a lot of people would never know that. I have a client right now who has breast cancer, and she also has a genetic disorder where one of her kidneys is very low functioning, but her other one is 100%. She actually is approved to use a weight loss drug post chemotherapy and radiation, but also because it's going to help prolong the life of the kidney that is not working well. Okay. So it's very important that there's things that are happening well beyond. Also, any type of liver disease. Wegovy is approved for to help people not have basically non-fatty liver disease, or people who do not have cirrhosis based on alcohol usage, but who have cirrhosis, basically liver scarring from either the lifestyle or something else may be going on with them. So Wegovy helps to reduce liver scarring. So there's so many things, ladies, that can be happening that aren't just about losing weight or that I've struggled. Okay. So the reason why we're talking about this is because, again, it is the most probably asked question. It is the concern that too many people are dealing with around, do I, don't I? Do I have to? Is this the only way I'm ever going to do it? And so I want to make sure that I clear that up right now. This is a tool, and nobody ever needs to say yes to this tool, but I want you to understand it exists and why people may be using it, but you never actually have to go that route. People in this age range, no matter the struggle, you can lose weight without it, but you just have to understand when the time comes. If you felt like you needed support, we don't have to feel ashamed about saying that you need support. But everybody, as I said earlier, I want to reiterate, everybody must develop new habits, new skills around how you eat, right? How you exercise, how you train your body, and how we manage stress and how we handle sleep. Okay, I'm going to pause here for just a second. I think I may have seen a question in the chat. Okay, what is the difference between semaglutide and peptides? Fantastic question. So, these actually are peptides. All right. So when you hear the term that will all of these GLPs are a form of peptides, but the peptides that we're seeing marketed right now around um, burning fat a little bit differently, copper peptides, if it's peptides to help with sex drive, there can be peptides to help regrow your hair, peptides to help with muscle repair. They're just a different kind, but the GLPs are actually peptides as well. Okay. So the only difference is each of these function differently, and are made for a different purpose. So these that we're talking about with the GLP-1s, we taught them on the street GLP-1s, twos, and threes. But the term is still always GLP. It's just on the street, we call them twos and threes. So when you heard me say the tirzepatide group, those are actually, when I said the double agonists, we call them GLP-2s, but they just have two receptors that they focus on. And then you may be hearing on the street the GLP-3, the term, but it's still called a GLP-1 with 3 agonists, okay? And that's what you call retatrutide, or you hear people for short say Retta. Those are all considered to be peptides. Then we get into another part of peptides, which is muscle repair, and that's where you hear things like BPC, BPC, or TB. You hear those terms. There's copper peptides that people are using in injection form, in needles, but then also injection form in your hair. People are also doing peptides like you may hear NADs. There's also peptides for low libido for men and women. And so all of those are all the same. They're targeting receptors in your body. They just have different purposes. Does that make sense? Okay.
Yes.
But they are all called peptides. So it's very interesting because then you guys may also be hearing people do like peptide stacks and all of these kinds of things. I will say this, nothing wrong with doing them, but understand just like the supplement industry itself, all peptides right now, especially when we get away from the semaglutide or either tirzepatide, those are FDA approved. Now, some of you may say FDA approval means nothing to me right now, but I want you to understand it should still mean something, okay? But I know better. I've been doing this way too long. People will do what they want to do. So I want to just make sure that you're able to make the most informed decision for you, whichever way you choose. Okay. But when you start getting into the peptide Retta, right? Right now, Retta is not FDA approved, but it's in the final stages of approval. The issue there is reputable sourcing. And the difference is because it's a triple agonist, basically retatrutide is like the third generation of the GLPs, and it helps you preserve muscle mass a little bit better. It also will manage blood sugar control, but it also helps with insulin sensitivity better than the first two generations. So you find people with higher levels of weight loss with better preservation of muscle mass off the top, even regardless of your protein intake and things like that. So you just see a slightly better. So that means you see people with maybe better skin control, better skin laxicity if they're losing weight at a rapid pace. But the principles for all GLP-1, 2, or 3 is still the same principle around protein intake and the lifestyle. Okay. Never forget that. And then you also have better body composition with the third generation because it will target fat storage better than the first two because the first ones, that's not what they're made for. Okay. It's that third piece of the puzzle that actually is targeting fat storage a little bit differently. Okay. So that's kind of those peptides. But understand that then when you start seeing them stacked, know that there are no studies to go along with stacking peptides, okay? Clear. There are no studies that go along with stacking peptides. However, do people do it? Yes. There's stacks called Glow Stack, Clo Stack, and the Clo Stack has 4 peptides combined. The Glow Stack has 3. The problem is, again, none of those in combination have ever been tested. The singular peptides, they actually all have some form of tests, whether the studies finished or not, they all still have some form of a study enough to know what they're good for, okay? What the peptide itself is good for, but they may not be FDA approved. So that's why I say just because it's FDA approved or not does not negate if something actually works. However, reputable sourcing is the biggest concern around buying peptides without them being approved. I want y'all to drop me a little note. Let me know that you understand what I just said. Just yes, no, I get it. Drop me a note. Let me know that makes sense, that we understand. Okay? Perfect. All right. Just a second. Okay, now let's get to some of those myths real quick because the fact is there's too many of them. First myth that we think is the easy way out. We think that any type of GLP is the easy way out. Truth is, it's not. It is just a medication to help quiet appetite, quiet the food noise, but it does not build habits. So it's not easy because even with quieting down the food noise, you still have to do all the things. You don't get to not build habits. You don't get to not work out. You don't get to just eat whatever. So don't think that it's an easy way out. It just helps you, just like anything else. It is a tool. Okay. So I want people to stop with the it's the easy way out because that's where people feel shame because they think that I'm weak. I couldn't do it. I lack the discipline. These are the things that people said to Serena Williams, right? She cheated. She didn't cheat. She used a tool. Okay. Myth number two, that any type of injections do it all for you. They do not. Because I can tell you that for many people, it doesn't work. You know why it doesn't work? Because they're not doing any of the work. And so nothing will do the work by itself. You still have to strength train, eat the protein, exercise, work on actively losing weight, manage caloric intake, right? We still have to do that. Myth number three, that losing weight is automatically means that someone's healthier. Absolutely not. It doesn't mean that. When people are taking doses that are too high, which means that they did not slow down the process, meaning they started with doses that were too high and their weight loss is too rapid and the food noise is so low that they're either barely eating or they're missing food groups, protein intake is too low, and so their weight loss becomes too rapid. So that can create deficiencies. Okay. You can lose a lot of muscle during that process, and we want to preserve that muscle. You can also be finding that people are just getting weaker, or depending on how long someone is taking these higher doses, you can see nutrient deficiencies, which can cause hair thinning, it can cause cavities, tooth decay, nails that do not grow or nails that are breaking. So you can see skin issues, all kinds of things. And I'm not talking about laxity skin issues. I'm talking actual rash issues, eczema, things like that when you are too rapidly losing weight. And so it does not necessarily mean you're going to be healthier if you don't do it the right way. All right. And then number four, that once somebody hits their goal, that they could just stop. So the truth is, if you have not built the habits, you can't stop like that. But the point is, along the way, as you're using this tool that helps a person, it allows you then to build the habits and gradually wean down. And that is a plan that must be created. So you gradually wean down, wean down, wean down, wean down until you're at a place where you don't need it at all and you've weaned off completely. But that takes some time to do that. And then for a year, you manage your caloric intake with the same level and you make sure that you have to, work on keeping that same weight for a year. That's how your body will help itself reset. Okay. So you want to be able to manage that pretty slowly. Okay. But here's the catch. What happens alongside the drug? This is where it gets really important. What do you have to do? The practical pieces that you got to do at your house. Number one, protein first. Period. Why do we do that? Because the drugs are helping quiet down the noise. They're helping reduce your carb need. They're helping reduce your sensitivity to them as well. So while you're losing weight at a slightly elevated rate, protein intake is what you need in order to rebuild tissue. That helps you with maintaining skin integrity. It helps you with maintaining muscle integrity and then building muscle at the same time. That is why we do that. Okay. And then somebody's got to lift weights. Whether you like it, understand it doesn't matter, ladies. You got to learn to love it. The strength training at least 2 to 4 times a week. I would tell you optimally 3. It's going to help you as you lose body fat because it's going to help you maintain muscle and for many of you, build muscle. Okay. Then we got to move and stay hydrated. One of those consequences is that some people say they get constipated, but you got to understand why. Okay. You're eating differently. The way that your body is processing meals out and the timing, it gets different. So you have to stay very hydrated to make sure that that can move through your system so that you don't get constipated. And we got to move our bodies on a regular basis. That's just part of the habits. Okay. You got to build habits, reiterate that, so that your results can last and that you're able to taper off the medication when you're ready to stop. So you're building habits every single day along the way. And then you got to have a team of people around you to help you, which means some type of qualified provider, coach, trainer, somebody like myself. We're helping people manage the journey so that you do it the right way. All right. Now, the most important thing is that we're trying to bridge this gap between the future of what medicine looks like, but also with the tools of the past. And again, nobody needs to use tools at all. But I just want you to understand that if you choose to, this is what it would look like. Okay. So remember, some of these things that are coming forward, the retatrutide, that's going to be the next wave. So know that it's there, but understand it is a tool nonetheless, and it will be one of the most aggressive tools that anyone has actually ever seen because it's the thing that will target body fat better than anything that probably has been on the market since the late 80s, early 90s. All right. So we got to be very careful. But just know that this is the super important part of why we do what we do, how this is happening at this stage of life. And so that you understand what are the trends, what's really going on out there, and do you need to do it? All right. And so part of that is the thing that we'll actually even be discussing in the next seminar in September. So on September 12th, that's going to be a little bit of what we discuss during this session. The last one we had was in May, and this session, the next one will be in September. And we'll be able to talk a lot more about the future of modern medicine, but also get rid of the myths, understanding what's important and what you need to do on a regular basis in a room filled with women who look just like you, who are experiencing the same thing just like you. All right. Now, where do we do this? So, if you're here and you've watched this, the things that you heard today, this is the normal part of the communication that I have either with clients who are current clients or individuals who are inside of my community. And this is a great way for you to join and stay in the conversation. I go live in that community every single week. Plus, it's full question and answer, and it doesn't matter what you want to know about. Nothing is off limits, whether it's a vaginal dryness question, low libido question, anything to do with your fitness, how to eat differently, how to work out differently, anything that comes up. Hey, my ears are itching and I'm not sure why, but it is a community to help you thrive during this stage of life. And this is a great way to continue this conversation that we are having today. So, what questions do we have at this point? So, I know there's someone there. What questions do we have right now? I'll pause just for a second.
I think for me, I think that with all of the JLP conversation is, I guess, how to know which, if you are going to consider one, which one to use. There's so much conversation on it that it gets really confusing.
So, what is really important is if someone wants to use one, and again, everybody listening, know that you do not have to use anything. And at this stage of life, sometimes we can feel like the only way to lose is to use one. No. And we're going to be going over that on September 12th. And then I'm going to drop this quick note up here because those of you who are watching this who actually have this question and you are not on, I want to make sure that you see that you also, if you would like to, you can schedule a 15-minute conversation with me to ask a few of these questions that you may have missed or not been able to ask because you're watching the replay or you didn't want to ask it live. But this is a way for you to be able to ask that question and I can help you put together a little bit of a plan of attack on what's really going on. What do you need? Okay. So we can work together to get that done. So the question that is asked live is how do you choose? The most important part about the choice is what's happening to you. Are you someone who needs blood sugar control? Do you already have, are you already pre-diabetic? Do you actually already have diabetes? Do you have high cholesterol? Do you have high blood pressure? That is how you will choose what you need. If it's a little bit more all-encompassing, you need a little bit of everything, it probably makes more sense to do the terzepatide grouping, right? That grouping, that GLP double agonist. It may be better for that. But if you want it all, right? Then you may be someone who says, no, I want to wait, or I want to get the retatrutide, or I want to find a reputable facility right now who has it because that's the one I want, right? Because if we're dealing with body composition, we want to actually control some metabolics, and you also want to reduce, inflammation. Well, maybe you've got some pains in your body. These things are also helping with pain management, right? And so there's a lot of things that you go on. So it truly depends on what's happening to you. And that's how you choose. Okay. What other questions?
My other question would be, so you said, so as far as like tapering off something like that, because I'm not, and I'll be 100% transparent. I'm not like at a place where it's like I need to lose a ton of weight, but I'm at this place where it's been really stubborn. And so when I talked to my doctor, she mentioned that it might be a good option to just get like a little jump start. But my concern is I don't want it to be something that I am on long term. So like is could it be something that is just like considered that way, like a jump start while I get these, like the like you mentioned, like the best, not, well, I forgot how you said it, but basically like the like things in place to kind of like continue and making good decisions, and then be able to taper off of it. That's like my biggest fear is like I don't want to be on something that if I get off of it then the weight is going to come right back on.
Okay. So good question. And I will say this. So when you are talking with your physician, and that's super important, everybody, when you're talking with your physician, you want to ask all of the questions, but you also want to understand like why they've said what they said. And I would tell you that when you think about having a jump start, that those words in and of itself, these are medications that they don't really jump start you because you actually have to begin to do things a little bit differently in your routines. But what it does do is, I believe it allows individuals to start to be more consistent than they ever have been. But I don't like to view that as a jump start. I think a jump start is you doing the work slightly first and then adding that in as a tool because you have already begun the habits. Because once you start, this is not something that say you can jump start. A jump start would imply, right, that you could take something for like 30 days and just jump off. No, I would not say that that is real because depending on which group you use, let's say it's the semaglutide group, it's going to take 30 days for you to even build into the dosing. And so in the beginning, it's not jump starting you, right? It's not. Then if you're in the terzepatide group, about 2 weeks it'll take for you to probably notice like, okay, this is going to be a little different because again, they gotta titrate up the dosing. All right. Even if somebody lost like 1 or 2 pounds, I don't necessarily think that's a jump start. I think that is literally you actually going to have to eat differently at the same time, but you can't just jump off. Okay, because you haven't built up enough time with it to just jump off. And then if it's retatrutide, that is going to work the fastest. You probably even in your first week may notice a pound gone. However, because of that, think about what I said. It's going to be the one that probably is going to work the fastest. However, just as it goes off fast, it's going to come back fast. And so it doesn't really jumpstart you. It's literally allowing you enough time to build a habit. So I would tell anybody who thinks that they want to try it, I think you have to give yourself a good, let's say, and depending on, especially if you're not trying to lose, say, 50 pounds, say you're just trying to lose 15 or 20, right? I think that you should give yourself, if your objective is a jump start, think about a jump start like 90-day window jump start, not a month. It's like a 90-day, 4 month jump start and then wean it down because you're not trying to lose 60 pounds. But if someone is trying to lose 40, 50, 60, 70, 80, 90 pounds, you want to plan that they're probably going to be on these medications well beyond a year, 2 years, and then, really weaning it down. Or not ramping up fully to these high doses and it just be slower progress, but consistent progress. Okay.
Thank you. That makes a lot of sense.
Yeah, so just definitely if it's just like 15 pounds, still think that that's like still 90 days worth and then tapering down. It won't just go like 90 days and stop. It'll be 90 days and then tapering off. And it'll take more than a month to taper off. Okay? What other thoughts?
So with the with these, support products, and trying to, and I know how you mentioned like protein first, and like making sure, but then there's that whole like food noise, and I know I've heard people say that they're just not hungry, that food just, it just sounds like nothing sounds good to them when they're on it, and so it's like, how do you get over that? Like, you just have to force yourself to eat, or like, is there, I don't know, is it like, I don't know. Is there a better approach to it, I guess?
So usually when you're hearing people say that they have zero appetite, that's when that dose is too high.
Oh, okay.
Okay. That's when it means that their dosing needs to be put back down because the objective is not for people to have no appetite. Because
Mm,
when people are walking around with zero appetite, they literally may eat once a day or they won't notice until they're about to pass out that all of a sudden their body has alerted them they are starving, okay? And that creates more illnesses. It creates more nausea. It's going to create more stomach concerns. And that's not what you want anybody to be experiencing. So it means that their dose needs to be lowered. Now, it will kill food noise even in the beginning with low doses. So you want to find that happy spot for individuals where it's kill the food noise. They're able to manage the caloric intake that they need for them, but that we still have an appetite, that we're eating consistently, and that you're exercising, that you're able to do all of the things without feeling like I've got to force feed myself. Now, you may still have to have a food alarm because you can be so distracted by, I'm not necessarily getting those cravings, especially people who used to have maybe snacking habits or a lot of craving habits. So then we have to be very careful. And that's why it's very important that then that dose may need to be dialed back down just a little bit. But you do not want people having zero appetite because that's not the point.
got it. Understood.
Mm-hmm. Okay. So now, ladies who are watching later, and for my team who is here right now, remember that if you want more of this information and you feel like, hey, I heard some things today that I didn't get to ask those questions, but I really want to, you can scan this QR code and go ahead and set up 15 minutes with me. And we can just talk about, hey, maybe what that plan looks like for you, where you may be struggling. It's not a pitch, it's about you just understanding what you might need and how we could put something together. Okay. And then just a reminder, September 12th, we'd love to have you in the room. You can already get your ticket, but it is an expanded version of all the things that we've talked about today and that we'll be talking about in this series. But it is live, it is local, it's a way to connect, but also a way to understand even more about what's going on with your body and how we're going to make sure that we move forward. Okay. And of course, if you like what you heard and you just want to hear about it all the time, this is where we join that community. $47 a month, you're going to get these types of answers and a ton more inside the community, live in there. And it's just great value and great community. So think about if you want to join. But thank you for being with me this evening. And again, if you have any questions, I look forward to seeing you set up your 15 minutes. But everybody have a wonderful evening, and I'll see you next time.
Thank you.
You're welcome.